Hi, I'm Bridget Bartley with the Woodrow Wilson Rehabilitation Center, and today I have with me David McGinnis. He is the Veterans Mental Health Coordinator with the Department of Mental Health, Mental Retardation, and Substance Abuse Services. Can you tell me a little bit about yourself, your
Bridget.
program?
Yes, I'm a retired military officer who came to work for the department, for the state mental health department, about 2 years ago. And as part of that process, Commissioner Reinhardt asked me to also assume the role as a state mental health coordinator for veterans. And I've been doing that now for about 18 months, working very hard at it, from the national level on down through the local level, through the community services boards. And it's an exciting challenge, and it's a very needed responsibility that in the Commonwealth, because we rank third in the nation in numbers of people deployed since 9/11, and that's a tremendous number. It's about 130,000 veterans, and if you multiply that by about 2.3, the family factor, you understand that we're talking about hundreds of thousands of people are being affected by these deployments, and we're seeing the effects of that already back in the Commonwealth, right. Both in our system and in other systems.
What are some key components of your program?
Well, the biggest challenge we have with the veterans is getting them to recognize they have a problem. Traditionally, most individuals with behavioral health issues have a difficulty recognizing themselves, and everybody recognizes around them first, and actually the people around them, and especially their families, are the victims. The first victim. They don't realize they're a victim until certain situations occur normally. Unfortunately, mostly it's with law enforcement or some other emergency medical situation that brings the condition to their mind, and they understand the magnitude of their problem. So what we're looking at is putting together around our existing collection of treatment capabilities, both in the Department of Rehabilitative Services and our department, and out in the community, in private and nonprofit organizations. We want to put a ring of enablers that will allow us to draw these people in, and out beyond that, a ring of what we call first responders or sensors to identify these people. So theoretically, with veterans, one of the biggest problems is traumatic stress disorder. Right. And we hear about it all the time, and we don't really understand it. And many times where that promulgates itself is in the car. And so one of our first responders are going to be the police officers who patrol our streets, and primarily the state police who patrol our highways. So what we need to do is to bring this program together so that we can help them understand the challenges they face with these folks, and then work within the judicial system to help bring them into services, and not in the traditional way, because the traditional way we deal with acute conditions, and it requires a very difficult and stigma-building process of getting people legally committed to treatment. We don't want to do that. Right. We want a system that will help draw them in and enable them to get treatment and get back to a normal life. And many of them can if we can intercept their condition early enough in the family. So that's the process.
Excellent. Thank you so much for
your
welcome. Service and everything that you are doing, all your hard work and commitment to our veterans and our returning future veterans. Thank you.
Thank you. Appreciate it.